Hello, my name is Matt Stabel. I'm one of the producers of Nyaka News. Welcome to episode 2. We're featuring Paul Nzerebende, and he is the Monitor and Evaluation Officer at Nyaka. And the foundation of Nyaka is in the staff in Uganda that get all the work done and take care of our grandmothers and students. And we get to hear stories from teachers and staff all the time. This one's a little extra special because we're going to be discovering how we get the statistics we reach and some of the most exciting statistics that Nyaka is presenting right now that we've discovered. So, Paul, can you go ahead and introduce yourself and tell us a little about what you do?
Thank you, Matt. Thank you for that introduction. So I'm called Paul Nzerebende, like Matt said, and I'm working with Nyaka as M.E.A.L manager, monitoring, evaluation, learning, and accountability. This department was incepted about 20 months ago, and the journey has been interesting, challenging, full of critical thinking, and a lot of innovations to help us build an impact measurement capacity. Through the monitoring, through the evaluation, and as you continue learning, you're able to account for your work, you're able to account against your targets, you're able to account stakeholders, you're able to account to the communities and the people that are investing money and time and resources in you. So that forms the M.E.A.L monitoring, evaluation, and learning and accountability component. And why it's important is that once you're not doing it, you deny yourself the opportunity to first of all monitor your work, but also evaluate it using the standard principles. But also you're not able to get the best practices from a high level. And also your level of accountability is only limited to things like outputs, things like activities and success stories. So undertaking a monitoring program in your project organization helps you to reach the highest levels of what you're trying to do. It all starts with understanding the gaps and then leveraging the resources that we have, including staff, the communities that work with, and others, to actually build a system for M&A. So when I joined Nyaka, we embarked on building a system that is result-based, but also digitized and automated. Why? When you build such a system, you're saving time, you get quality work, you save costs, you save up 90% of what others are using if it's not result-based and digitized. But also, everything happens in real time, so you're not left behind. When it's happening in real time, those in USA can get it, those in Kampala can get it, those in Canada can get it, those in UK can get it, and those in the field can get it. And so you don't need to control it, but everything controls itself. And also you don't need to hire 20 people to run an M&A department. You need 3, 4 people. And every time you have a lot of work, you can always bring in volunteers, or you can always bring in other stuff. So our M&E is result-based, digitized, automated, and has been decentralized to every department. And so when we talk about impact, when we talk about having a fully fledged department, we are talking about having everyone in Nyaka participating in monitoring and evaluation, but also they are able to see their work and their results as and when they are working. So every day you can check and understand the status of the grandmother program, you understand the status of the SGBV program and all the other programs, because they are digitized and the work is coming in one place. So we've achieved that. And also we've started undertaking research for our work. Research, I mean, we design research studies for our work. We are already designing our report through graphics so that it's presentable and easier to read. Our designers are working hard to ensure that the numbers, the stories, the images, the statistics, the analysis, and the interpretation of everything, the story from our data, we are democratizing data, and we are also showing the world that investing in social programs like grandmothers, schools, and others, is actually one of the best ways of investing in human beings. It's okay to do it in business, but social investment and social returns have become real. From the education program, I'll just highlight the top level indicators, 4 of them. 1, our education is aiming at ensuring that children who are vulnerable can keep in school, are able to complete school, and also they are able to pass with good grades. But also their overall being now, well-being, their overall well-being, their future success, their growth, Nyaka ensures that they are happening as though these children are not from vulnerable communities. So from our current standing in as far as impact is concerned, Nyaka so far is registering a 97% learner retention rate. Every child Nyaka puts in school, out of 100, 97 are able to reach the top marks, the apex of what they are studying. If it's P7, they are able to reach primary 7. If it's secondary, they are able to reach senior 4. If it's university, they are able to do their final exams. So 97% are doing so, but of course the 3% is because naturally some children will transfer to another school. And then completion. Completion means when you start primary 7, you do exams, and the national exam system grades you to have completed. So right now, our secondary has been registering 100% for the last 7 years. Then our primary sector has been registering around 85%, but last year it increased 92% compared to the national average, which was 32% last year. So Nyaka is maintaining one of the highest retention and completion rates. But also talk about performance, the quality of our education compared to other schools around us. You realize that when you talk about the first grade and second grade, Nyaka has been doing around 75% for the last 5 years, compared to 23% by other schools and around 15% or 13% at the national average. So I would attribute this again to the quality of the education program that Nyaka is running. Finally, from the education, the well-being of the learners. Well-being means you're living positively, your prospects for future success are on the right track, and also you're hoping that if things remain as they are, you're competing with other children of your age and who are privileged to be in a well-off environment or something. So our education program is registering 93% well-being rating, and this rating is solicited from the learners who are undergoing the program. So I would say that the standards and the quality and the outputs or the outcomes or the impact from the education program is way above, and that is in our impact report. The grandmothers. So Nyaka has embarked on caring for grandmothers so that in turn they can care for a huge number of vulnerable children, mostly orphans. And these grandmothers currently in our books, they're taking care of over 80,000 vulnerable children. And so the 20,000 and above grandmothers that Nyaka is supporting, the aim is to ensure that their incomes are able to support the children. So you can refer to their incomes as the economic stand of these households. Our figures show that when a grandmother is enrolled into the program, their daily income, which contributes to their overall annual income, is around $1.06. But the World Bank says if you're below $2.15 per day, you're in extreme poverty. At 1.06, that's below the extreme poverty. But as Nyaka continues engaging the grandmothers, training them, providing the grandmothers with microfinance, constructing homes, contributing to their status of their water so that they can access clean and safe water, and also visiting them, encouraging them, teaching them. We saw an increase from 1.0, from 1.06 to 2.18 in 2021. Now we move out of COVID and the numbers increase to 2.67. That is close to 2.5 times what they were what their economic status was at baseline. And of course, these numbers then trickle down to the net wealth of the household. The numbers can be seen in the livestock value. The numbers can be seen in the agriculture value, the business value, and all the other aspects of their earnings have also increased over time. So once you see that increase, now you move to the children. You ask yourself, how are the children doing now that the grandmothers have seen an increase in their economic standing and welfare? How are these children now doing? Our figures show that children who are under grandmothers that are in the Nyaka program have progressed in terms of their well-being. Talk about education, talk about their economic well-being, talk about their health well-being. They have progressed and they reported an 83% well-being for them, those children. When you compare with grandmothers who are not in the program, the Nyaka children or the Nyaka grandmother-led offices are reporting 83% versus around 72% by their children. So the difference in their well-being status can be attributed to the work that Nyaka is doing. But of course, we have questions that we're asking ourselves. What can we do for the grandmothers that we haven't done so that these children can start reporting a well-being rating of around 90% or 93? If the education program is reporting 93 and the grandmother program is reporting 83, what can we do to cover the gap? Then finally, I'll give you something from our health program. 12 years ago, when Nyaka started the health program with our clinics, Nyaka was serving around 2,000 people through consultations. 12 years later, it's now 11,000. The increase in number of consultations has gone so high, with a huge percentage of over 400 or 500%. Every year, Nyaka is now giving over 200,000 doses of drugs to patients that come to the Nyaka clinics. But also, you realize that the level of outreach has kept on increasing, and also the level of engagement through different programs at the clinic. For example, OPD, dental, antenatal, all these have grown in numbers. And this is attributed to the service being accessible, the service being low cost, and largely free for majority of them. The program aims to reach children and the elderly, the grandmothers who are taking care of them. And our data shows that 75% constitutes children and their grandmothers. Then, of course, the other community members, the youths and the adults, are covering 25%. And of course, our priority is to keep this age group, children and grandmothers, healthy, productive, so that they are able to continue growing and learning, especially the children growing and learning and thriving. Maybe let me give you just one statistic on the SGBV. When Nyaka started SGBV in 2015, we enrolled 2 clients, or survivors. 7 years later, the number has grown by 3,300%, from 2 survivors in 2015 to 243 in 2022. The demand has grown so high. But also, again, the program aims to protect children from sexual and gender-based crimes. Again, around 80% of these are children aged 0 to 20 years. But the girls are 95%. What does that tell you? Nyaka's effort from 2015 to now has been recognized by the community. The investment into the SGBV program is actually reaching children, and many of them are girls and women. Yeah, we've seen some tendencies of boys, 5%, but the boys are not being affected by rape and defilement. Largely, they are being affected by child neglect, physical assault, and related. So the investment into the SGBV program is one, trying to protect the children, but also preventing the crime of SGBV. But also, Nyaka is helping in the healing process of this. We also mentioned that the number of perpetrators last year grew by 33%. What does that mean? that as we seek for legal or judicial justice for the survivors, and as we continue helping them through the healing process, rehabilitation, and providing psychosocial support, but also engaging the community through trainings and other activities, Nyaka will continue needing resources in terms of money, staff, time, and space to continue impacting the growing numbers. Our overall goal is to see SGBV going away. But because it's an evolving issue, you don't expect it to go away completely, but you can expect that Nyaka will continue addressing the response part of it. Nyaka will continue addressing the prevention and then the advocacy. So the growth is enormous, the need is enormous. Nyaka is doing its best to subvert it, but the work that lies ahead is still a lot. We want to demonstrate that investing in people, grandmothers, investing in children, investing in SGBV survivors, investing in patients is not just a mere donation that everyone makes, but you're investing in a return that is visible in the way these people look in terms of their economy. You're also investing in terms of returns on well-being, the positive living of every individual. You're investing in health, and it can be seen through productivity. When you invest in a microfinance program to a grandmother, you're able to get returns. So our data shows that we have around 280% returns on investment for a grandmother program where you have invested for 3 years. And so we want to continue demonstrating these returns and impact so that we create a very strong ground for people to invest in Nyaka, but also for other organizations to follow suit. And keep knowing that every investment, let it be $10 or $5 or $15, that you invest in a household of 5 or 10 people or 6 people, these are the returns that you can expect. These returns are translated into improving the quality of life of those communities that are in hard-rich areas, that are rural, that are living below poverty, the poverty line, but are also deprived in very many ways. Everyone who is doing NGO work can take shape and say, okay, as much as I'm doing NGO work, I should not just sit and report outputs, but I should go beyond and do additional research to understand my impact and also to let the world know that investing in NGO is not just to improve life, but it should be demonstrated. The 17 Sustainable Development Goals, I've not seen an organization that contributes to all the 17. Maybe it's only the UN that is contributing to all of them, but Nyaka is contributing to 11 SDGs. And these SDGs speak directly to the international desires of seeing a better world, seeing a more healed world, and seeing a world that is full of equality, balanced, and moving forward. So Nyaka will continue contributing, that as much as we are achieving our mission, which is to work with communities to learn, grow, and thrive, we want to also contribute to the global stand through the SDGs. So our data and our work with M&A and all our processes of M&A have to, in a way, align with our mission, vision, and then the global standard, which is being measured through the SDGs.